Hello, my name is Nia McLeod. The topic I selected for my technology application brief project is the Prescription Drug Monitoring Program, which is an electronic database that tracks a patient's prescription history of controlled substances. It serves many purposes. It helps the government identify and prevent prescription drug abuse. It helps the physicians and law enforcement detect doctor shopping. It can help detect Medicaid fraud and can also be used for research purposes. The Prescription Drug Monitoring Program is a state level government program which is managed differently from state to state. Each participating state has passed its own legislation that establishes which agency has primary responsibility for maintaining the database. And some of these agencies include the Board of Health, substance abuse agencies, law enforcement agencies, pharmacy boards, and professional licensing agencies. The legislation determines who can have access to patient information, the process for requesting information, the types of controlled substances that are monitored. As many may know, as provided in the Controlled Substances Act, Title II of the Comprehensive Drug Abuse Prevention and Control Act of 1970, there are 5 schedules of controlled substances that are grouped together that are primarily based on each drug's potential for abuse. And there are drugs that are added onto this list from time to time. So legislation determines for that particular state, again, what controlled substances are monitored by the program. And legislation determines whether the responsible agency proactively monitors for unusual or suspicious patient-prescriber activity or just provides patient-prescriber activity upon request from law enforcement, and whether patient information is shared with other states. In New York, it's the New York State Department of Health that manages the state's official prescription program. Prescribers, law enforcement, licensing boards, and patients may request patient information. In addition, redacted data is provided to researchers. Prescription data is collected from pharmacies and prescribers. However, pharmacists and pharmacies cannot request patient information. The Prescription Drug Monitoring Program is an example of how the government uses modern technology for centralizing data to more efficiently address social issues. Prescription drug abuse is a major problem in this country. According to the Center for Disease Control and Prevention, deaths from drug overdoses have now surpassed accidental or injury death in the United States, which is due in part to the alarming increase in the abuse of prescription drugs such as Percocet, Valium, Oxycontin, Xanax, and Ritalin. Some of the advantages of the program are that it allows law enforcement to gather information more quickly for their investigations into drug diversion schemes. The program can help identify and treat patients with the prescription drug dependency problem. And in addition, the data collected in the program can also be used by researchers for studies on prescription drug use and abuse. Some of the program disadvantages: it prevents patient privacy issues, and although the data is centralized and only allows for limited access, the program exposes very sensitive information to a wider audience beyond the prescriber and the patient. If information can't be shared between 2 states, it may cause people to cross state borders to get drugs. Furthermore, out of fear of heightened scrutiny by law enforcement, doctors may not prescribe painkillers to patients who really need them. The good news for New York State is that this past summer, the Senate passed more strict legislation, which includes upgrading the electronic database as well as mandating the electronic submission of all prescriptions. And I really like this idea because New York now is taking a more aggressive stance and will serve as a leader and also be an example to other states to help in the fight against prescription drug abuse. Thank you.